Okay, could I have the panel members come up and take a seat at the table? All right. As you can see, we will not get through all of your questions here this afternoon, but we'll try to, if you put your name in email, we will try to get you all a response. Here's an easy one, and I think we can take care of this one pretty quickly. Are disabled vets that receive care through the VA required to purchase health insurance, or does that satisfy the law? Ralph, you want to take that one? To VA care,
Yes.
Yes is the answer, correct. Yeah, so the VA is a qualified plan. So if you're getting insurance through or if you're getting your health care through the VA, that qualifies. That's my understanding. Do we know the answer to that?
Who are you asking?
I don't care.
Ask Commissioner.
I'll ask Commissioner.
As far as I know, yes. Any qualified plan that you're doing now, you can, well, I'm not going to say that. The president said if you like your plan, you can keep it. That's a bunch of baloney. If your plan complies with all the essential health benefit aspects, the 10 groups, then you're going to be able to keep it.
Right, and I think I did read earlier this week that the VA's plan does qualify. So if you receive your health care coverage there, you should be okay. On October 1st, how many insurance companies will offer how many plans in each of the categories? I think we know that there's 5 carriers. Now, we talked before about the fact there's platinum, gold, silver, and bronze. I think the question is, do each of the insurance carriers offer each of the levels within their plan? So does Blue Cross Blue Shield offer all 4?
No.
Okay, and how do we know what offers what?
Well, that's going to be the responsibility of the navigator to be able to tell you which of those plans. Now, your bronze, silver, gold, platinum are actually the actuarial values. A bronze plan has to offer 60%. It has to be a 60% actuarial value, meaning the plan's going to pay 60% of the group's health care costs. The patient's going to pay 40. Silver is 70. Gold is 80. Platinum is 90. There's no plans that will have an actuarial value of 100, where 100% of your health care costs are covered. You're going to be, I'm going to say, on the hook. You're going to be responsible for 10% of these costs.
And I think one of the things we've been told, although we haven't seen the plans, and is like Blue Cross said, they're not offering a platinum plan. Is that correct? And the reason being is you've got a lot of people coming on with pre-existing conditions. They don't know, the companies really don't know who's going to be coming on. So they're not going to offer a very rich plan and be selected against. So.
Let me add to that you talk about 5 companies that are going to be offering. The only company that's offering in 159 counties is Blue Cross Blue Shield. Humana is offering in most all the counties. They're not down in Southwest Georgia. And then Kaiser is only offering in Atlanta and Athens, where they provide services. Alliant is only offering in Northwest Georgia, and Peach State is in the Atlanta area. But all of these plans, all of these products are not done deals. They have not signed contracts. As one of the speakers said, Aetna and Coventry pulled out on the last day. July 31st was the day that I had to certify the rates that had been supplied. We on July 31st, about 11 o'clock in the morning, I got a phone call from the head of Aetna and Coventry, and they said, Mr. Commissioner, we want to withdraw our plans for consideration in the health exchanges. So that took us from 7 down to 5. I've talked to the CEOs of some of the other plans, and I'm not going to mention their names, but they say that if it looks like we're going to get too many people that are going to sign up for our plan, that it's going to make it unprofitable for us, we're going to pull out. And so they can pull out up to the day they sign the contract, and that they have not signed those contracts yet. So it's still up in the air of how many plans are actually going to be available on a Georgia federally facilitated exchange.
Okay.
Is there a cutoff date for the contract for them to sign?
I'm sure there will be. It's got to be before October 1st,
First.
because theoretically they're supposed to go live October 1st.
Right. And as a follow-up to that, how do I sign up for the exchange? So it's October 1st. I want to sign up. Where do I go?
I know, boy. We're not playing Stump the Commissioner now.
My understanding, since Georgia's federally facilitated exchange, you have to go to healthcare.gov.
Right. So it's out of Health and Human Services then.
Yeah.
And I assume then you will go to Georgia, which will give you a list of the plans and the level of metals within each of the 5.
Well, they're going to direct you to either SEEDCO or UGA.
Got it. Okay,
And
good.
then they're the ones that are going to help you
The navigators.
determine. Right.
Got it. Okay. All right. Is the tax penalty on adjusted gross income? Do we know the answer? Is the tax penalty on adjusted gross income? Sue,
Here's our CPA.
Not to my knowledge.
okay. Okay.
Give Phaedra one.
I'm trying to find one
Favor
here.
a tax question.
Currently, seniors, those on Medicare, I think we addressed this maybe. Seniors on Medicare can buy supplemental insurance from AARP or other vendors. What are the choices that will be available in 2014 and beyond as a result of the Affordable Care Act? So this is a Medicare-related question. Will people only have access to insurance through the exchanges?
Well, I don't think that the Affordable Care Act addresses the Medicare supplemental. I mean, there are some changes to Medicare Advantage, but otherwise, no, I don't think it's addressed.
It's not addressed. It's not an issue.
Correct.
I think if you're on Medicare, you're going to be unaffected. And the same thing with Medicaid. That's the reason that the design of this whole thing, when they originally said that if a state didn't increase their Medicaid rolls to 133%, that they were going to lose all federal funding for all of their Medicaid expenses. But the Supreme Court ruled that to be unconstitutional. But that's the reason they were trying to take a segment of these uninsured population and drive them into to be the insured group through Medicaid.
Okay. If someone purchases coverage from an exchange in October and is eligible for a tax credit based on income, when will the coverage become effective?
January 1.
January 1. How will my tax credit be applied? I think we talked about this. How will my tax credit be applied and when? You won't get a check in the mail, I think is, yeah.
Well, no, the tax credit is going to be sent directly to the insurance company.
All right. If an employer of less than 50 employee currently offers a flat rate toward an individual policy, if the employee chooses to have one, will the company be forced to offer any other type of coverage? I mean, that's the
An employer less than 50
Yeah.
employees is not required to offer
required at all,
coverage.
right. So the go, no-go is 50.
Right.
Right.
Well, plus the 50-plus employee has been kicked down the road a year, so that's not
Right.
going to take into effect until January 1st, 2015 now.
Employer mandate. If the government has a shutdown, will the government-run healthcare exchanges be available during the shutdown?
Take that one, Commissioner.
I didn't write them, I just read them.
Don't call my office.
I know, I mean, no, let me say, these are great questions that you all, I mean, they're great questions, and I think that the panel is giving you guys the most recent up-to-date information that we have. I mean, they're not holding anything back. This is what we got.
To look further into that, if the federal government shuts down, the University of Georgia is primarily funded through state dollars. And so I don't see any reason that their extension service would be shut down. And that's where the University of Georgia is offering their exchange to the citizens of Georgia through their cooperative extension service. And the nonprofit organizations that form SEEDCO will not be shut down. So I think that the navigator aspect of the federal of this federally facilitated exchange would be manned. On a side note, there's been a state representative, and I can't remember what his name is, that is a little offended that the University of Georgia is offering up to be an exchange facilitator by being a navigator. And he says he's going to introduce law or a bill next year. It's not law until the governor signs it. He's going to offer a bill that would prohibit the University of Georgia from participating as a navigator in these federally facilitated exchanges. Now, whether that'll get any legs or not, I have no idea, and I'm not going to get involved in that. I'm not in the legislature anymore. Praise the Lord.
Okay, what happens if our employees want to decline our corporate coverage and buy on the exchange instead? Can they do this?
Yeah, but there's a fine to be.
They can do it. However, one of the advantages as an employer, if you're providing health insurance, you're typically providing at least 50% of the employee-only premium, okay? So if they go to the exchange, they'll lose that. They've got to compare your employer contribution to the subsidy they might be available to them and their family. So they got to look at that. But you understand, if you're over 50, you'll be penalized if they do that and they receive that subsidy.
Right here, so
The employer will be penalized. What's that?
the question is, would they lose the subsidy? Right, so the employer, you've got 75 employees, they're clearly over the 50, they offer a plan, the employee says, no, sorry, I'm gonna go on the exchange. They go to the Kaiser Family Foundation, they run their calculator, and they say, I'm gonna try to do the exchange here.
Yeah.
Do they lose the subsidy? If it's affordable.
That's right. That's right.
Okay, so is everyone here? Okay, so if it's available and if it's affordable, right, they are not eligible for the subsidy.
That's right.
Correct. And whether or not it is affordable is determined by? Okay, so we don't know. Okay, and the point, I think this is a good one, if too many do this, if too many people jump onto the exchanges, we will not have the numbers we need to buy our current insurance coverage, right? So if you're around that 50 bubble, you have 5 people drop out, or if you're 45 and you have 5 people, that 50 number is important.
Oh, yeah.
Oh, this is interesting, being here in Georgia. I understand that some unions are now opposing the Affordable Care Act. Why?
I'll tell you why, because the current health the current health benefit package they have exceeds the $10,000 per person or $27,000 per family, and therefore they're going to have to pay that. The union's going to have to pay that 40% Cadillac tax, and they have very, very, very rich health benefit plans, and many of the unions have now come out opposed to the Affordable Care Act.
Right, I think Dr. Corso mentioned that was, back in World War II with the wage and price controls, that's when this whole thing started, that it was offered as a benefit. And if I correct me if I'm wrong, but it was a way for the government not to have to compete with salary with the private sectors in World War II. So they capped it. Is that what you've heard?
You go ahead.
Yeah.
I already said my piece on
You
the
said your piece. Nobody heard you, though. I think that when you had the wage freeze during World War II, by offering a benefit package to somebody, you could lure somebody away from one of your competitors, and you say, you come to me and I'll have to pay you the same, but I'll give you health insurance, I'll give you paid vacation, I'll give you so many holidays off, increase these benefit packages, and that's when health insurance became a function of your employment, not an individual responsibility. And when you have health insurance through your employer, when you leave that employer, you don't have what do they call it? Portability. Thank you. You don't have portability, and so that's the reason that a lot of the people are talking about that health insurance ought to be an individual responsibility, and you be able to take it wherever you go. But then pre-existing conditions kick in, and it's kind of a vicious circle, because on a group plan, pre-existing conditions don't come into play. So I don't know what the solution is. I know that Representative Tom Price, I heard on the radio today, is offering an alternative to the Affordable Care Act, and he's got many sponsors on that. But I don't even know what it covers. I was on a panel with Representative Price the other day for the North Fulton Chamber of Commerce, and he mentioned this, but he didn't go into any details whatsoever.
Okay, we have time for one more question. Can someone explain the 60-day notice of plan changes?
Well, okay, I'll attempt this. Okay, what you've got is if you do make any material modifications to your plan outside of your normal renewal, you have to give your employees 60 days notice prior to making that change. So let's say you have January 1 effective date, but you postpone that and but due to something, and you want to make changes February 1, it just for whatever reason got pushed. You would have to let the employees know by December 1 essentially to make that change for February 1. So any material modifications, any changes that you make to the plan have to have 60 days notice, but does not apply to your normal renewal time.
Okay, very good. Let's give our panel a round of applause. Thank you. And I'll turn it over to Kit.
Good job.
Lots of questions. I have another handful. I don't know whether these guys can stay around just a minute or two if you have a specific question, but we'll try to answer some of these and have it, or either you can email it to the chamber, another question, and we'll try to get it answered by these experts. I do want to thank you for attending today. I hope you have some good takeaways on healthcare reform. As we go forward, as Rob mentioned, we'll keep in tune, and if we need to have an update, we'll certainly let you know, because things are changing. We will have a link to today's program, the whole program, on the chamber website, and I think the other sponsors will do the same. and someone had asked about a hard copy of a particular presentation. If they have slides and a hard copy written, we will have that, and we will have that available to you. I want to particularly thank Rob Fowler from Turner Wood & Smith and Steve McNeely from Northeast Georgia Health System for putting together the program part today. So join me in thanking them, but thanking all the participants. But all the participants, I think they were great. Rich Sanders, Dr. Phaedra Corso, Course Commissioner Hudgens, thank you, and Rob and Steve, and sponsors today, again, Turner Wood & Smith, Northeast Georgia Health System, Brenau University, and Rushton and Company. Hey, visit the sponsors on your way out. Have a good fall day. Thank you again.
Once again,